Hey everybody, I am Diana Braun from the Knee Zone. I'm joined with my husband and expert surgeon, Dr. Raj Sinha. We are moving on now to Heather, Maria, and Terry, who are in early phases of recovery. And I see a few others of you that are also on early recovery. So we'll maybe try to jump over that depending on how we're doing on time. We're going to be live for an hour. So top of the hour, depending where you are in the world right now. We're 20 minutes into our hour. So Dr. Sinha / husband Raj, you want to take on Heather, Maria, and Terry.
So they're concerned about pain, stiffness, and sleeping at relatively early time periods after surgery. 6 weeks, 7 weeks, 3 months even. So the sleeping thing I'll let Diana talk about because she came up with a bunch of tips and tricks to help herself sleep and get sleep. But I think the mental aspect is another thing that you can talk about a little bit. But I think the important thing to realize is that from a surgeon standpoint, we look at certain milestones. Full extension, meaning all the way straight, bending at least to 90 degrees by 6 weeks, and then starting to walk without a cane and stuff like that. And anything beyond that is gravy. As long as you're hitting those milestones at those time points, you will eventually get there. Everybody recovers at a little different pace. I've seen 10,000 different people recover. So I kind of have a sense of what falls within the norm or what doesn't fall within the norm. But 6, 7, and even 12 weeks after surgery, having some achiness, having some trouble sleeping, having the feelings of stiffness, all normal. You got to keep working on your quad. Make sure you're keeping your knees straight. You want to talk about sleep?
Yeah, sleep is a big subject for me. So if you are a side sleeper, which is me, I found, and again, I had both knees replaced. It was really, really difficult. It was really, really challenging.
It was not recommended.
And, we'll talk about that another day because we don't have that much time today. So sleeping is going to be challenging. If you are a side sleeper, and you are getting ready or early stages of recovery and you're really having trouble sleeping, do your best to try to sleep on your back. Obviously, that's going to make it a lot easier. That was nearly impossible for me. It's just not something I'm comfortable with. So I started getting like really, really squishy pillows, like these Squashmallow, like stuffed animals are really popular right now, but anything that's super, super cushy. There's some like airline pillows that are like really cushy, foamy. You can put those in between your knee joints and that will really help cushion it. Now, some other things. I always made a point to do exercises, some sort of movement of my legs, like cycling. And if you don't have like a PT bike type of thing at home or a foot pedaler, just lay on your bed and put your legs in the air and pedal them just to kind of loosen up that joint before you try and fall asleep at night is going to make a big difference. Also, if you can, time your pain medication as late as you can before you're going to bed to try to calm things down. Now, there's something in the book I talk a lot about in the early stages called zingers. It feels like lightning strikes going through your bodies. And if some of you are in early phase, you can relate to this. It's very uncomfortable. Does not feel good. Those nerve endings are trying to reacquaint themselves, and don't ask me why, but they tend to like about 3 a.m. to try and get reacquainted. They're like, they're like raccoons in the neighborhood trying to go through your trash. It's the nerves in your leg. So all you can do to keep your leg moving before bed, time your pain medication, ice again right before bed should help for anybody struggling with sleep. I am your person. I get it. It was really hard for me for many more months than I expected. So
can I add 2 things to that?
Yes, of course. You're the expert. I'm going to lean over so you can get more center on Instagram.
The other thing that my PA actually came up with, my physician's assistant, was telling people to put the medication on their nightstand so you don't have to go very far. Yeah. Make sure you have some water on your nightstand when you're sleeping so you don't have to go very far in the middle of the night. The other thing that we've done is we've created a chart with timings of medications. And of course, patients can adjust when the start time of that is, but having a chart so you can track the medications is very helpful for folks. And the last thing I would say is that a lot of people, they get to the point where they're 4 or 5 weeks out, like, I don't have any pain during the day. I'm walking, I'm doing my therapy, it's great. But at night, oh my God, what is going on? The throbbing is excessive. I can't. So what's happening is muscles that you haven't used that much are being used a lot. And during the day, while you're using them and you're moving, they're doing great. But when you stop moving them, they tighten up, they tense, and they get really painful. If you can take an anti-inflammatory medicine around dinner time, actually, 6 or 7 p.m., that helps you get to sleep.
Thank you. I hope this was helpful. We'll look forward to seeing you next week. And be kind to yourself and your knee. Knee replacement's hard. It's not easy, but it's worth it. I can promise you.